Assalamualaikum and welcome to
Beyond the Stethoscope.
Saya Dr Zahirah.
Dan saya Dr Misra. Yes, we are back hari ni, minggu ini. Siapa tetamu kita pada hari ini? Yang paling penting adalah kita nak explore tentang pengalaman dan cerita sebenar tentang mereka di sebalik klinik mungkin, hospital mungkin, and yes, even the stethoscope sini. Betul tak?
Betul? Okay, so every week actually kita akan menampilkan pada guest yang kita bawakan ni menceritakan background mereka kan daripada pengalaman perjalanan yang medical student sampai
sekarang
kan. So, perjalanan mereka orang kata apa mereka actually yang boleh memberi orang kata apa input dan juga insight untuk kita semua nak share.
Betul. Dan don't forget, kalau suka channel podcast ni, hit the like button, subscribe to our channel and tap kita punya bell
notification.
Yes. Dan kita sangat appreciate kalau ada kata ada apa-apa kata pandangan yang benar dan juga penambahbaikan dalam video ini. Okay? Okay. Dan jangan lupa tinggalkan komen untuk apa kita nak buat hari ni dah.
So biasa saya nak ceritakan lah siapa yang kita nak tampilkan hari ni.
Yes.
Siapa yang kata rasanya sama juga kan. Macam sama kita sama semua dulu kan. So yang ni boleh bisa ceritakan perkenalkan kat apa?
Boleh.
Kepada hari ni.
Saya suka buat nak kenalkan orang ni. Okay, betul. Dia adalah yang kita bersama kita houseman dulu dekat hospital. Lepas tu dia adalah senior kita. Senior sikit pada kita. Lepas tu dia yang banyak bagi input juga. Kita berkata kita yang pindah ke Sabah dulu. And then we meet up kat sana. Kita membuat aktiviti apa yang kita ke Sabah. Kita dah tahun lepas. Tiba-tiba terserempak. Satu kampus pula dia tengah sambung master program. So dengan itu saya kenalkan Dr Jae.
Welcome to, thank you for your kind introduction. Thank you Misra, to Zahirah. I'm Jae. Sekarang master student dekat Hospital UKM, Hospital Cancer Kampung Muris.
Yes. Okay. Jae, kita nak tanya sikit kan, macam dah berapa lama dalam medical professional ni sebenarnya?
I started my housemanship in 2015. I think sekarang dah 9 years in medical professions.
Good.
Dah senior ya.
Tapi sebenarnya nak tanya, orang mana sebenarnya ni?
Saya dari Penang. So I did my housemanship in Penang GH with Misra and Dr lah.
So basically Jae, kita dah tahu nama kan, dah segi seberapa lama. So sebelum macam basically kalau every podcast ni kita akan tanya pada guys kita lah.
Kita akan flashback balik kan.
Macam kan orang kata daripada awal ni perubatan, maksudnya nak choose as bidang medical security career punya pathway kan. So after the SPM itself, so adakah you choose untuk masuk dalam bidang medical ni, adakah willingly ataupun Lee punya encouragement ataupun how? And then sebab kita tahu kan masuk medical field ni ada banyak pathway, ada yang overseas study, ada yang dalam negara juga kan. And then from which level? Is ada mungkin is it diploma,
matrix
or
foundation
based? Okay, alright, thank you. So basically I pilih medicals. I think it's because of my own wills and first and foremost is because of the SPM result is eligible lah. And I think cikgu-cikgu tak sekolah masa tu ada minta untuk apply for GPA scholarship, and masa tu I ingat nak sambung matric je so that boleh sambung dekat local RTTA things like that. Tapi after kita apply for GPA scholarship kan kita boleh pilih lah mana-mana bidang yang kita minat. So kebetulan me and my friends kami pilih medical professions lah, perubatan. So and coinciding quite lucky, I get a scholarship daripada GPA lah untuk pergi kat negara Russia untuk sambung study. So itulah. That's how we get my pathway. Another pathway actually for local student, I think you can go through the matriculations. Then if you get a good mark, then you can try to apply for a local IPTA. That's another pathway you boleh pilih.
Okay, macam Jae sendiri kata pergi dekat Russia, means like overseas. Ni first time kita.
Dekat mana tu?
Okay. Masa tu the program is actually 3 months of language course in Tech Alam, and then after that you'll be sent to any of the university in Russia that under government. So our country actually chose 3 university out of 5 university in Russia that to send their student, MARA, GPA, even private student pun pergi sana.
I see. Okay.
Susah tak? Maksudnya macam satu is kena learn the Russians punya language. I think so. Is it?
Yes.
And then macam how do you cope with the culture dekat sana?
Actually, okay, so first and foremost, have to learn the language. Language is not easy. Language is not my forte. So this is something that we all have to learn. But in Russia, our language of instruction is actually English. So we still are able to communicate with the lecturer and the students there in English. However, majority of the Russians only speak Russians. They can't speak English. So bila kita jumpa patient, kita kuat patient, we still have to use a very basic language, basic Russian language. So, but good thing in Russia is actually they're very welcoming. They are not as maybe scary as what other people say. They're very welcoming. They are very warming. All the babushka, the old ladies there are actually very nice to us. Yeah, and we also have a very small little Malaysian community there, which our senior. Sorry, we also have a small Malaysian community there, which our senior. Sorry. We also have a very good Russian community, Malaysian community in Russia. Sorry.
It's okay.
We also have a very good Malaysian community in Russia, which our senior from GPA and MARA actually have gave us a lot of guidance. So I think that's what makes us able to survive, other than adapting to the language, culture, and also the most important thing is the weather. It's very difficult to survive under extreme weather. So basically, I think their help is actually the one make us survivable in a foreign country for 6 years.
6 years. The course is actually for
The course is
6.
actually 6 years. In total 6 years.
So basically, what motivate you? I mean, like you can macam after CN. Is that the first time yang you being
Is it
far
far
from
away from the families?
Yes, that's the first time I go.
Homesick.
Sorry?
Homesick.
Homesick tak?
Homesick adalah sikit-sikit.
You got cry,
huh? We have a lot of friends there, so we still able to adapt to the local environment.
Okay. So basically, beside all these, what the motivator actually from your family side?
Yeah, I think the most important thing is you have to believe that whatever the God gives you is something that you're able to handle. And then second thing is your family members who is very supportive. They don't, they make us have can go study without any worry about them. So I think, and one more thing is their support, their moral support is also very important.
Okay, so basically, how the system ni.
Betul.
Maksudnya kita nak bagi tahu kat student, medical student yang mungkin dah dengar pada hari ni kan. So, pathway, if let's say they choose Russian as macam tempat untuk
sama belajar.
So, what the
Preparation
yang the student should do, and then, they don't kena buat. Maksudnya, by your experience for them to prepare untuk di sana, and then apa yang kena go through sana, and then how many posting, is it the same as kita local kat sini?
In Russia, I think the program is slightly different from local. The first year is actually like a preview in local university. So basically, you learn about all the basic subjects like biochemistry, physiology, things like that. So if you are hardworking enough, you want to study, prior you go to Russia, maybe you can read a little bit for the first year syllabus. So other than that, you have to learn your language well, at least some basic communication skills so that you can survive that. And then syllabus there is a little bit different because the exam also lain. Exam dia macam after every single posting or after end of the year, then we have exam. We are not like local university. They have exam piazzas for all different subjects. So our one is more specific, more targeted. Like internal medicine exam means that you will have different lecturers. So the hematologist is going to ask you hematologist question. Rheumatologist is going to ask you rheumato questions. So things like that is more specific.
Faham. So maksudnya daripada awal lagi undergrad tu sendiri diorang dah spesifik kepada subspecialty dekat dalam tu.
They also sambung their subspecialty, their specialty and subspecialty quite fast. So if you're interested in surgical field, then you can start get into surgical field in your 3rd or 4th year of medical student. For local student in Russia, so it's totally different. The system is totally different. But what we learn is almost the same. We're still using the same international guideline, like ESC guideline. But some of the classification, some of the guideline is different. We are not following the UK system. So and I think their medicine also has a long history. So we also follow the local guideline from that. But meaning to say that what I'm trying to say is that the first year, second year is same lah. Like it's like
It was under
you know the theory part.
Theory part.
That is the same. But only that one they more specific lah.
Correct.
Okay. Okay.
So how do you find yourself macam we do have in local side our professionals final exam kan. So from your side how they ensure that okay this one's finished already the punya the final one.
For example, in our 4th year, we actually do our final exam for pediatric. And then for 5th year, we do our final exam for internal medicine and general surgery. So that's a little bit different compared to local where they have all the exam together. So I think I would prefer the Russian system because it's more specific and we don't have to cram everything together. So it become very messy for myself. Sorry.
During the 6 years, right?
Yeah.
So let's say if you pass that the whole process, I mean the 5th and 6 years, the 6 years they don't have the last final
Our last final exam is in 5th year. And then our 6th year we will sit for all other subjects. For example, public health. Public health, all this kind of interesting topics for us is under 6th year medical student life. I think that has also opened our horizon. I think widen our horizon as a doctor that you not only focus on clinical but you also focus more on the public health side.
True. So from initial memang dah ada sub assessment every specifically semua benda tu kan.
Of course, they have after end of the what's it? Actually, we have the end of the posting assessment. Then we have the final exam in the end of the year. So that's how usually we do that. That's a little bit different, but I think the theory is almost the same.
Ada first second year kan? Yeah, almost the same.
Okay, kita dah cerita sepanjang dia punya undergraduate era kan. So macam mana macam mana you punya pengalaman datang balik and then apply houseman dekat
Actually, I think applying for housemanship is the same. We don't have to sit for another exam in local. It's recognized. So we apply housemanship for via the same pathway, local graduate.
So meaning to say like what you want to do to teach to the student, I mean the medical staff there is like kalau dia orang nak choose to be macam nak
pergi dekat abroad kan?
abroad punya overseas ke kan punya uni is they have to clarify whether that uni is established atau apa recognized in Malaysia lah.
If you want to study overseas, regardless of which country, you have to make sure that the university is being recognized by the local government or by our TKM. If not, you have to sit for another exam to be eligible to apply for housemanship.
Okay, so kita nak tanya je ni. Posting kat mana? Sebab dia dah tahu kat Penang kan. Why Penang?
Nak tahu lah kan, first, second, third.
Second choice, third choice kat mana?
My first choice of placement for housemanship at Penang GH. One reason is because I'm from Penang. And Penang is a tertiary center. So I assume that tertiary center we can learn more. We can expose more to different levels of management.
Sure.
So my second option is
Sultanah Bayar.
No, sorry. My second option is Sultan Abdul Halim, and then my third option is Ampang because masa tu
So jauh?
minat Hematu. So tapi at the end I got Penang GH. Penang GH Hematu also very good.
Kan. Okay. Sepanjang Penang tu kan macam your first posting itself kan waktu dekat Penang as a houseman, you pilih ke ataupun diberi? Diberi. Ours is kita flexible, we can choose.
Masa kita houseman, you can choose, but usually dia bagilah sebab my bag is quite a big bag. So they will send houseman to those department yang perlu lagi banyak houseman.
Okay.
So ada bahasa juga. So it's very good regimental military training. Those from Penang, you know, that's how it works.
True. Okay. So how do you find yourself sepanjang houseman dekat Penang sampai you finish your punya houseman dekat Penang?
Specifically, the first one is the But how about the rest?
How about the rest? The second, the third, fourth, and until
So
finish.
I think my second posting is medical. Medical is very busy. Initially, I don't want to do medical. It's so busy. And then after that, auto
Auto.
also very good, very nice. They're teaching. They are doing a lot of procedures.
And then after that is pediatric, followed by ONG, and I ended up in NS as my last posting. NS, we have a lot of intensivists in, not a lot, sorry, this one. We have a very good intensivist in NS department as well, and which give me a lot of inspirations and also guidance, which make me feel like maybe I choose maybe master program is something that's suitable for myself.
So berbalik lah sebenarnya houseman dekat Bina kan.
Tapi I think housemanship everywhere also quite
True.
difficult because of the long working hour, and then you still have to perform, and then you still have to study for the annual posting assessment. So yeah, if you want to learn, housemanship is actually the best time to learn. If you ask me whether we want to go back to housemanship, I think most of the people no. But it's a very good training.
Yeah, it's a good training, but untuk
2
masuk
years
balik,
is enough.
2 years is enough.
2 years is enough. I mean, like, any tips to survive?
How to survive?
Have to be strong, have to be really resilient. Kalau bos marah-marah pun sometimes they are not marah because they are aiming on you. They are marah because maybe they
For
just want
patient
to
safety.
for patient safety,
Yeah.
for the patient benefits, and also for your own benefits, so that
True.
you know that when you meet the similar situations next time, how are you going to handle it? So it's just a part of the training. Just take it easy. Sometimes if something good, you just take it. If something that you don't think is healthy for yourself, then you can just ignore it.
Betul.
Sometimes ignorance is bliss.
Okay. So after like enlistment, so kita ada choose untuk now kita final year then the placement for the MOC. So you choose kat mana and why?
Placement in MOship, I think we don't get to choose. It's something that given by the government, I think.
True.
My batch really dapat Sabah.
Yeah.
So yeah, and I think most of us went to Sabah.
But the way your first punya like try it.
Yeah, I got Sabah. Initially, I got Tawa. Tawa is another tertiary hospital in Sabah. I got emergency, but at that point of time, I'm not very sure what I want to choose at that point of time. So I decided to go to district to experience life. So I ended up in a district near to Kota Kinabalu.
It was in Hospital Tuaran.
Yeah, hospital Tuaran.
Okay. So how do you find yourself waktu kena hantar dekat Sabah?
You okay with it? I'm okay with it because back then I think I'm still young. So I think that it's better that we do it when we are still young and experience it. Because I think most of our consultants train us so that we can survive in the street. That's how the whole housemanship is about. They always say that deep in the street, you will face this and that. Yeah. So I think it's a very good exposure, and the learning curve is the steepest, I think, in district hospital. Because you're on your own, and then the only thing you can do is to, if you need to refer case, you need to consult, is directly to your physicians, the consultant. So it will be easier and you learn more by referring case and things like that.
So maksudnya macam orang kata hantar dekat Sabah tu, and then Jay sendiri berpengalaman hantar dekat district hospital, experience daripada houseman pergi kepada MO tu sangat guna.
Betul.
Kan?
So meaning to say kalau untuk kita kata dapat dekat salah Sabah ke
Sabah, Sarawak
sama
ke.
je.
Betul.
Depends on kita punya orang kata apa is mentality. I mean is
Mentally
orang cakap
prepared,
easy to
everything.
say or not, tetapi depends lah.
Betul.
Coping mechanism.
Okay. Sebab kita sepanjang MO ni kita dah nampak kan. Kita nak tahu di mana titik point di mana Jay rasa macam okay, nak ambil internal.
Okay lah, this is it lah.
This is it.
Until when? Kan?
Until when?
Kita akan guna ayat tu kan.
I think majority of the patients that, because when I went to Sabah, I work in a district hospital, so we have exposure to emergency unit, we have exposure to medical unit. So emergency unit is memang sangat busy dekat Sabah. Satu shift you're the only doctors, and then satu shift we can get 35 to 45 patients per doctors. So
Per
if you
doctors,
don't settle
okay.
your patient, you don't feel like you want to pass over the case, because some of the cases really difficult to pass over, because another shift they have their own difficulties. So I think emergency department is a good exposure for me to decide whether what I have to do for the patient next time, and then something you're in between the life and death of the patients, and then you will have to refer the case out. So after that, I entered medical unit for about 2 years with a visiting physician. So visiting physicians daripada Queen Elizabeth Hospital is the one yang banyak ajar. So mereka banyak ajar, mereka encourage, they do short case to be patients, they macam ajar macam-macam lah. So I think those registrar and physicians come from Queen Elizabeth actually guide us a lot. So I think maybe this is a good pathway. that. Yeah.
I remember tau waktu houseman tadi dia kata macam alamak masuk medical department kan. And then suddenly kan.
But I think medical is interesting lah. Sebab it's like a puzzle. Some patients is like a
True.
puzzle. You don't know what is going on with the patient, then until you solve it one by one. So that's the fun behind it. I mean, like that's a turning point. That's a turning point. Yeah, okay.
So basically, when you meet the biggest step,
Yeah, I think after
Medics.
2.5 years in Sabah, we decided that we wanted to do internal medicine. So there's a few ways that you can do it. One is you go through the para pathway. You can take MRCP UK or MRCP Irish. Another option is actually you go through a master program. So when you're after 2 to 3 years of your medical officer, you actually can apply for HLP, Hadiah
Latihan Persatuan.
Yes. So because I think I'm from Russia, so the system is a bit different. So I think I want to try to experience the local systems. That's why I try to apply for master instead of taking only MRCP UK. Maybe because those local grad, you can choose MRCP UK and MRCP I because it's, I think back in that time, it's a faster pathway to become a physician.
Okay,
maybe
faham.
you can share details a bit lah. Basically kalau macam in internal medicine sendiri kan, so dia punya exam how? Macam in Malaysia macam is it 2 years in hospital, 2 years in back in in campus ataupun how? And then what exam yang contoh kalau those yang nak ambil ni kan, berapa exam yang diorang kena ambil? I heard cases kan.
Okay. So one is para pathway. Para pathway they ada 3 paper. One is MRCP UK or MRCP is the same. So you have first paper, second paper is all macam one out of 5 answer. So if you pass that one paper is about I think 3,000 to 4,000 now. If you pass 2 of the written exam, you can actually sit for the PACES. PACES is about 7,000 to 8,000. So this is UK or Irish papers. So that is one you pass, then you have to nowadays you have to submit logbooks about 4 years of training. You have to submit the list of patients you have seen, all this kind of thing. Then once the KKM pass, then you boleh get that. So usually at least 4 years of training nowadays. Not like last time. Last time mungkin 1-2 tahun. Once you pass everything, once you started the logbook, you can
Directly
just become a
gazette.
physician. Yeah.
Faham.
So master program wise is very different. We have 2 systems nowadays. My one is following the old system. So the old system is actually the first year you have to sit for both theory and clinical exam. Theory exam is almost the same with the MRCP questions, I think, but slightly different because it's aiming for one best answer. So after you pass the theory, then you can sit for your clinical exam. If you are unable to make it for your clinical exam, and then you have to extend another 6 months to sit for it until you pass the clinical exam. So that's for your first year training. Then after that, second year, third year, you can go for your subspecialty training. We have about 10 sub in internal medicines. So you go for your subspecialty training. Then after that, you have to submit some case report so that you are eligible to sit for the part 2 exam, which is in third year. So in third year, you basically the same thing again, but this time the theory questions may be very different. There's written. There's some written other than the one best answer. Then you have to sit for clinical. Clinical is a bit different. So other than having a short case, you have to prepare for long case, evidence-based medicines, and communication skills. So 4 important parts. So I think the new syllabus is very different. They don't have to sit for the first year exam, but they have to sit for all the exam in their third year.
Really? They cram all the information in the assessment.
Third year is the time for you to see the whether you can pass as physician or not. When you pass your third year, then you have to focus on the thesis. Some people already started the thesis way earlier. Then if they're able to present their thesis or they publish before they present, so they don't have to sit for the final part of the exam, which is the part 3 Viva exam.
Oh, so there's exemptions there.
Yeah, there's exemption. If you're able to publish in any of the journal, so you actually don't have to present, but you may just have to present to the department. You don't have to go through the Viva again. So that is about master. I think the different a bit regarding master compared to MRCP is master actually we are learning how to do research. I think that's a very good, very important step for those who want to become physicians and who want to contribute a little bit to the medical science, and who are interested in research, then I think master is a good pathway to go.
Yeah, and some more kan in master program it's actually they ask us to learn macam evidence based semua benda
Yes.
informations kan.
Yes.
You kena cakap, dia kena ada evidence based, dia kena ada everything yang behind
All your
us yang
management
protects
is based
us.
on evidence-based medicines. There's no harsh and fast rule in internal
True,
medicines. You have
true.
to fit the patient's fit your management into patient scenario, patient conditions, and of course we still follow our autonomy of the patient, all these kind of basics, ethics principles. So I think that's
So basically, during, I mean, like for the local kan,
yeah.
How many, like, you know, if you macam if you fail for that particular year, do they like allow them to, you know, proceed to the second year, or they need to repeat all the
No,
exam
you
before?
have to pass the exam only you can proceed to the second.
And then
I see.
and then for how long? Because
How
tadi J
long,
bagi tu
yes?
is for 6 months kan.
How many attempts?
6 months. How many attempts?
3 attempts. You
3
only,
attempts.
maximum 3 attempts. But I think this time there is no more the old system. I think the new system is you can sit for exam anytime within the first 3 years. Once you pass, then you can focus on your thesis, but you still have to complete all your your subspecialty. But however, if you fail one time, the next time when you sit for exam, maybe you have to pay some extra to sit for the second exam. So people don't like violate like simply sit for the exam. The same thing they have 3 exams. But of course you can appeal if your jenis yang semua kuat, you don't think that you should give up at this point of time, then you can still appeal. To see whether you can somehow
Proceed lagi
to
kan.
proceed.
Okay.
Because like I heard like macam some of my attachment kan in postgraduate, so some of the medical punya ni yang on your past ni lah same, diorang ada buat macam tahu Misra personal course, sometimes diorang pergi to India something, diorang ada attend to that short case course. Is it memang I mean like
Is it
it's one
macam-
of the tips to them actually
To pass or
Okay, for me is if there's many ways for you to pass exam. Depends on whether you want to do it very targeted or whether you want to incorporate into your daily clinical practice. So if you want to do it very targeted, you can do both at the same time. If you want to do it very targeted, you can do some past test example, past year questions from seniors. You can do some MRCP, past test or past math, all this kind of past year question as well. It's actually for you to get familiarized with the
questions kan,
what they want to test on you, things like that. So sometimes one thing is to do past year questions. Second thing is for clinical. I think some of them choose to go to courses, basis courses for UK, some workshop. Even sometimes our university have some workshop that we call in some patient, but you have to pay a certain amount of money. So we call in some patient that is very specific that we don't really see on day-to-day basis, so that we get familiarized to this kind of cases. So when we see the patient in the exam, it's not the first time we see the patient. So it's easier for us to give a differential diagnosis and things like that. That's one of the tips. The second option is you every day when you see new cases, people refer you cases, you try to see the patient as a whole. Contohnya they refer you for diabetes, uncontrolled diabetes, maybe you have to see the patient as a whole, any side effect from the diabetes mellitus, all this kind of thing, walaupun nampak macam simple, but sometimes it's important for your management, because this is to test whether you're eligible to become a physician or not. Instead of just patient come and refer you for sugar, then you just manage the sugar levels, then I think that would be not so complete as a physicians.
Bagus lah. Maksudnya macam orang kata that was macam salah satu inisiatif yang bagus. Kita tengok patient as a whole, tak terus targeting on dia punya tu kan. And then you create what is the orang kata differential diagnosis to come up with the professionals punya tu kan.
Because sometimes the referring team, they might not from medicals, they might maybe from surgical base. So their main focus is operation, pre-op and post-op care. So when the patient have a non-communicable disease like DM hypertension, and sometimes even they might not able to pick up certain disease that is very common to you, but it's not common to them. So when they refer to you for example, a reason A, maybe the patient has something that you need to exclude, like reason B and things like that. So you're able to see the patient as a whole, so you can catch the illness earlier. You can catch the illness earlier, then you can manage more correct. I mean,
Yeah, I remember about macam the beauty about medicine kan. Dia mungkin boleh start from medicine and after that refer to the respective punya department ataupun from the respective punya department datang balik kepada medicine untuk ni
But
kan.
then like, kita tengok balik kan, benda ni actually you all kena, I mean like when the opportunity comes, just go and explore kan.
Betul,
Macam
betul.
you should-
Ah.
actually,
Don't
you can
limit
learn from the
yourself.
patient sebenarnya. Like sometimes
Yes.
kan kita, they always like macam sometimes kita tend to like mesti tak nak tengok patient, but when it comes to exam, benda tu you tak
Betul.
practice, lack of practice, you tak boleh.
Lack of practice is one of the reason why we get not
Yeah.
we feel very strained with seeing the same type of patient in the exam.
Right.
So I think sometimes exam can come out in certain cases that is very rare that you don't even see in real life. But the good thing about exam is most of the time is common thing is common. Like they still give you the very common cases. So you'll get used to all these common cases, then I think at least you are giving yourself confidence to sit for the exam.
Like the routine kan.
Yes. So I always take my patient, maybe some of them are coming to teach me something.
Nah.
Some of them is for me to help them with something. Some of them maybe just neutral, just like normal doctor-patient relationship. So we are trying to help them as much as we can at their own capacity. And at the same time also based on their medical literacy. So you have to educate them, have to empower them. Now we more believe in patient empowerment. So
Betul.
you give them the ability to adjust their medication themselves and teach them this medication for what. So that they can understand their medication better, they know what illness they are having, things like that.
Wow. Menarik Ira.
Yeah.
Kan? So kita nak tanya kan, ini bakal-bakal kita punya physician nanti
How
kan?
many years to go?
If anything goes well, another 1 year.
Alhamdulillah.
I'm working on my thesis now.
So macam
physician.
future physician.
So what actually you punya harapan kan?
You punya harapan.
Kita nak tahu what I mean like ni your goal. Okay, once you become a physician, so what you want to do something yang to change.
To
I mean,
change,
like, the system to up. I mean like to improve.
To improve.
To improve the system.
Correct.
I think first and foremost, I think I will make sure myself is a safe physician. Sometimes
Yes.
we still not see enough. So I think we learn along the way. Not necessarily have to learn from consultants. I think you can learn from a houseman, you can learn from a medical student,
Anyone.
or your junior, anyone, your staff nurses, your medical assistant who are very good. So to improvise, I think we want a more healthy environment.
Yes.
We want a more
Positive
healthy
one.
environment. Yeah, we don't want like last time. Registrar marah first year, this kind of thing.
We want to motivate.
Yes, we want to motivate people to learn because if you're able to create a harmonious environment for everyone, everybody will be happier working in that. Basically, we want a healthier environment for younger generations because now we are facing new system, the contract doctors, things like that. So I think a lot of people don't have job security. So what we can do now is actually to cultivate their interest in the field that they're interested in. So not necessarily they have to be interested in internal medicine, but I think basic medical knowledge and clinical knowledge is something that's important for everyone. Even though you're internal medicine doctor, I think the simple suturing is still important. Or if you're a surgical doctors, I think basic vaccine management also you have to know about that. So what we want is actually a healthier environment for younger generations to make them not scared to ask questions. So basically what we want for our younger generation is, I believe they want a healthier environment as well. So you have to give them the freedom to ask questions, and then you have to show them the guidance that they require. Sometimes you feel very stressful when you're lack of guidance. So which is unhealthy, and you don't want to create a toxic environment. Yeah, you don't want like being someone who is more superior and schooling in younger generations. Because if you want them to perform, you want them to come very early to work, you yourself to come early.
True.
If I want to come on time, I don't expect someone junior than me to come earlier at
Earlier
6 o'clock to come and see cases. Of course, that's on call doctors to be there, responsible until office hours. So I think that's the environment we want to create to teach them things that sometimes they don't actually encounter. So everybody see the same cases, maybe different people have different assessment, different approach. So if you're able to assess patients the full, you educate them on, of course, sometimes you can learn the same different thing from that as well. So I think once they learn the thing, they actually can apply in the next patients. So I think that's how intergenerations knowledge transfer works in medicine.
So any tips to what you call it, macam kita punya doctors kan, ataupun yang choose, dia rasa want to do that, into medicine. So what the encouragement words ataupun advice you can give?
Okay, for those who is interested in the medicine, most mainly is of course is knowledge. Not to say you have to be super brilliant and super smart when you're doing the medicine. It's all about your own efforts. If you're free, then you study, you get updated with the guideline, and then you join different. You need to have a bunch of friends or a bunch of colleagues who's interested as well. It's a bit difficult if you are able to find people who want to study with you, then you might not be able to learn fast. So you want to learn fast, at the same time you have to work together. And one more thing is resilient. Colleagues can be very difficult, especially during on-call times. There'll be a lot of referrals, everything happen at the same time. Patient collapse here and there, referral come here and there, and then consultant call you. Different things happen at the same time. So you have to know what is the priority. I think that's a good thing that I learned from this week is you prioritize your patient first. You prioritize patient in the get-rate zone, that's very unstable first, then only you slowly go to see those patients that's more stable. That's one thing. Second thing is, I guess, for sorry, sampai mana dah?
Your tips tadi you kata macam
Resilient. Okay. One more thing is have to work together. I think with your consultant, your physicians, and your houseman or your medical officers, then to work together as a team. Not like this is husband job, this is MO job, this is consultant job. If you're able to facilitate each other, then things will run very smooth. And one more thing is inter-department issues. You have to learn how to communicate with other people, and so that everything can go smoothly. Because at the end of the day, our aim is just the same. We just want to do something for the patients.
betul.
So, very punya orang kata apa, very deep kan?
Very deep, very comprehensive, very full of
and then
information.
So thank you so much, Jay.
Thank you, Jay.
For coming and then for sharing. Okay, and good luck for your
Good luck for your future undertaking.
one more year to go.
Especially today. Zahirah, thank you so much for having me here. Thank you.
So we
Okay.
wish you all the best. Best of luck for your thesis, right? You're the last one.
Exact tu, I belum decide lagi lah. Tengok mana hospital yang I can choose lah.
Is it Penang?
Is it Penang back?
Back to home?
Maybe Penang, maybe around KL area. Not very far this time. Followers. Thank you so much.
Okay semua menarik kan? So yang penting jangan lupa tonton
Setiap episod kita dengan siapa guest kita, of course dia akan beri orang kata satu kita sangka mana betul-betul luasannya, banyak tips dan information yang kita akan share daripada pengalaman kita. So till then, stay tuned. Saya suka jangan lupa orang tengok kita stethoscope. Okay, saya suka bilang benda ni, never stop. Someday you will be someone who will you could be someone who will.
Okay, jangan lupa mungkin juga itu adalah rezeki yang jangan benar kata apa sarapan so there's always light.
Betul, cahaya. So dengan itu, bye.